Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
The Delhi government has announced that they have 6,600 beds, out of which only 2,100 are currently being used. This comes as great news to Delhi, as currently the numbers are on the rise. So this is good news that patients perhaps won't be left in a lurch with nowhere to go and no beds available, as we are expecting the numbers to keep rising. But there's an interesting detail here where different hospitals are doing differently. For example, between AIIMS and Safdarjung, both are government hospitals of course, but AIIMS still has beds available, whereas Safdarjung is completely overwhelmed. I have spoken to sources at Safdarjung Hospital, and they say that patients, coronavirus patients, are being referred from RML, from AIIMS, from NCR, and even from various places in UP to Safdarjung Hospital with corona cases. When I inquired further about why this is the case, the Safdarjung sources, they said that there is a sense that although hospitals like AIIMS are admitting patients, when their condition is deteriorating, they are then being referred to Safdarjung, and that the same thing is perhaps also happening with other hospitals like RML. So in order to reflect a better fatality rate, perhaps my sources have told me that AIIMS, RML and other hospitals are moving their worst of coronavirus patients to Safdarjung Hospital, and that is leading to this particular hospital being more overwhelmed than others. The Delhi government has also said that on Monday it will be coming out with an app where people will be able to see how many beds are available and where. Because right now there are patients who are not being able to access the resources which are available. There are patients who don't know where to go, although there are beds available. And of course, the lump sum of beds have been made available in private hospitals. Right now there are 2,677 beds in private hospitals which are available, and this is after the government made the announcement that all private hospitals with more than 50 beds are to reserve 20% of them for coronavirus patients. The Delhi government has also said that by 5th June the number of beds should be at 9,500. So the Delhi government is really gearing up for the expected spike in coronavirus numbers in June-July this year. Further, the Delhi government has also said that they've attached hotels. 5 hotels have been attached to various hospitals in order to make even more beds available, and these are the different methods by which the Delhi government is expecting to hit their target of 9,500 by 5th June, and perhaps then think of expanding even further as need arises. This is Suryatapa Mukherjee for Mojo.